This is breaking news.
Happening right now, Governor Hochul is making a reproductive health care announcement at Judson Memorial Church. Let's go to it now.
What this is about. So, as much as we're here to talk about what we're doing for New York State and our providers, and that's critically important, it's also we're facing the grim reality of what's happening to our sisters across this nation. Just last week, the report came out. In 66 clinics in 15 states have entirely stopped providing abortion services since Roe was overturned. It's had major, major implications for people. Just imagine the trauma. You saw the early stories of children having to be sent to other states, or people having to travel across many state lines just to save their lives in some cases, or just to stop a 14-year-old from becoming a parent. That 14-year-old is not old enough to drive. That 14-year-old cannot have a drink. That 14-year-old cannot adopt a child. But to think that despite what they want, the government would force a child to become a parent is disgraceful. And that's not just hyperbole. That's not saying, oh my gosh, the sky is falling. The sky fell on that day, and it's affected women and children, teenagers across this nation. We are seeing in the Queens, we just talked to one of our providers there, they had a huge increase of people coming from all over the state. We knew it was happening. We knew it was happening. We were ready for it. And I said, we'll always, always be the place that people can come to and allow people to make their own decisions. And I'm so glad I have allies in the state legislature. I have allies, and I have also allies in a health commissioner. And let me be clear. It makes a difference on whether or not your health commissioner stands with you philosophically and to the core, the belief that women have a right to make their own health determinations. Dr. Mary Bassett does that. But with our legislature as great partners, we're finally on the journey to enshrine the rights to reproductive freedom to an abortion in our state constitution. It's a journey. It passes the state legislature not once but twice. It goes on the ballot, but the journey has finally begun. We also mandated insurance companies in the state of New York have to cover abortions. We also signed, yes. I signed a package of 6 bills to protect our providers, because we have vigilantism going on out there, where people, especially from other states where they've said that someone can be prosecuted, charged with murder, if they assist in an abortion of one of their residents. So I needed to send a message loud and clear that our providers in the state of New York will not be extradited. We are protecting you, and we'll make sure that there's no barriers to you doing the work that you've chosen to do, and we're grateful you are there. We also launched a public relations campaign. Because right now, the rights of millions of women across this country are in the hands of just a few states. If you don't think it matters who your leaders are in your states and in your state legislature, that is the wake-up call. That is the wake-up call. Because it's often a matter of life and death for the mother as well. But we're here to continue the fight. We're undaunted. We're tough. We are New Yorkers. And we'll not back down. Not now. Not ever. And leaders, just like they did here, against the tides of popular sentiment, stood up here in Judson Memorial Church. You are the inspiration that we need, even all these years later in 2022, to carry on the work. And to be the change makers, just like the suffragettes who came before, and the civil rights leaders and the LGBTQ movement that started right here. All of you, the doctors, the advocates, the champions, the elected officials, will look back at this time and know, be able to tell your children and grandchildren, I stood up. I stood up against what was happening, the assault on women's lives. You carry the torch that has been passed to all of us. It's our responsibility, it's our moral responsibility to continue to fight. So yes, as sad as it is that a fight that became in earnest during my mother's early years as a young mother up in Buffalo, it's a right that I took for granted, that my daughter took for granted, my little granddaughter, Sophia, cannot take for granted. And I never foresaw a world where this would happen. That is the reality we're living with right now. But we don't give up. We don't give up, because we will fight. We'll fight like hell to make sure that no one ever touches these rights right here, and we'll be that beacon of hope. We'll be that safe harbor for women all across this nation. It starts with the providers and the grants that we have for them to do their jobs. And any way we can support you, you can count on us, count on New York to be there for all of you. Thank you, my friends. Thank you. With that, let me bring up Dr. Mary Bassett.
Wow. Thank you, Governor Hochul. It really is such an honor to work for you and to listen to these fighting words, which is what we need right now. And it's wonderful to be in this iconic space, which, as all of you know, has been a place, a hallowed ground in the women's health movement. And we heard some of that important history this morning. I also want to echo the governor's thanks to providers, and we'll be hearing from Dr. Claire, who are working across the state to provide vital abortion care and reproductive health services. We have always known that this is work that carries danger, impossibly so. But it has become so much more fraught now, and I want to thank them for providing these services to patients every day. And of course, the governor's action, which is really leadership on a national level, means that New York State, as it has since 1970, before Roe v. Wade, remains a safe harbor for abortion access for all who need it, and we will keep it that way. This work is so important, and it's more necessary than ever before. 13 states have banned abortion, and more are likely to follow. There are 22 states that have laws that could restrict the legal status of abortion, and these states are home to 30 to 40 million women who are of reproductive age, and they now lack access to the abortion care that they may need. So we knew, as the governor has said, that from our history, the role that the state could play. We knew that before Roe v. Wade, 400,000 abortions were performed in this state, 2/3 of them from people who traveled from outside of the state. So we started getting ready. And I'm immensely grateful that Governor Hochul did not hesitate to prepare New York State. With our $25 million abortion provider fund, we made immediate investments, and today, as you've heard, we're announcing additional investments. 37 separate applicants will be providing services that span 64 unique sites. We looked in our second round of funding to include family planning providers, other licensed healthcare providers, independent clinics, all across the state. And we considered the communities and parts of the state where it would be most difficult to access these services following the Dobbs versus Jackson decision. So in round one, we awarded $10 million to 13 programs. That was 63 sites under our comprehensive family planning program. And we did more than that. And this is something that the governor didn't mention, but was so important. We began conversations with reproductive health providers, and we began roundtables where we met with providers on the ground to discuss the challenges and opportunities and needs as we go forward. And that's the basis of the governor's commitment, listening to people and hearing what they need to make sure that we have facilities that are safe and secure. She also, with our colleagues at the Division of Criminal Justice Services, put forward $10 million in funding to improve security at facilities. So, simply put, abortion must stay safe, legal, available, and accessible to all. Abortion care is both a medical intervention and a human right. Thank you. So, you know, right before the Supreme Court released its final decision, which was anticipated but astounding, many women came forward, including me, to talk about their personal experience with abortion. Everybody's entitled to a private life. This is something that I had never done before, but I thought it was important to make our stories known. And for the first time in Elle magazine, I wrote about having had an abortion when I was a medical student. And this is an example of the kind of unprecedented times that we're in, where our collective work and our stories, we must continue to destigmatize the fact that people need this care. So, working side by side with Governor Hochul and abortion providers, the Health Department will continue to work to assure that reproductive health centers are fully supported and that we will meet emerging and unexpected needs. You know, if abortion access and reproductive health care more generally is to be protected, it will be held by the strength of state policy, by the promise of public health, and by the will of the people. This is a fact. Everyone who respects the right of women, all people, must work in concert to preserve and support these rights. So we have to consider ways to increase availability of the oral abortion pill and extend the number of providers who can work across states, not just within states. And we have to continue to break down the barriers for those who need more education, resources, and support to access safe abortion and reproductive health. So I'm proud of our Abortion Access Always campaign, and we have a website. I'm always supposed to mention our websites, which is newyork.gov/abortion. The truth is that abortion is a health issue that affects the whole of our population, not just people who have a womb. Every woman, every girl, every person who comes to New York seeking an abortion must know that their health, their choices, their lives are theirs to live as they choose to live them, and that matters. So I want to thank again our governor for these nation-leading efforts and the new awards that we're announcing today. We have promised that the calls for care will not go unanswered. So with that, I'd like to bring up somebody who's on the front lines of this struggle and introduce Dr. Camille Clare, who's the chair of obstetrics and gynecology at SUNY Downstate. She has many honors and other hats that she wears, but I'm going to acknowledge her today as the partner to the Department of Health on issues of reproductive health and maternal mortality. Thank you very much, Dr. Clare.
Well, step one, I made it safely to the podium, so that's great. So thank you so much to Governor Hochul for this extreme opportunity to speak to you. I'm Dr. Camille Clare, as mentioned, immediate past chair of the American College of Obstetricians and Gynecologists, ACOG, District 2 here in New York State, representing 5,000 OBGYNs, and thank you for my colleagues who may be here in the audience. I'm also, as mentioned, chair of the Department of Obstetrics and Gynecology at Downstate. As a practicing OBGYN, this is an extremely challenging moment in our country's history. I stand today as a proud New Yorker. I'm a diehard New Yorker, as many people know, though I'm acutely aware that our fellow OBGYN colleagues and their patients across the country are facing a dismal reality. Due to laws that are not based in medicine or science, OBGYNs are being forced to violate their medical training and turn away patients due to fear of prosecution and the possibility of being stripped of their medical license. Some OBGYNs are faced with deciding if a patient is sick enough to receive abortion care and hope that prosecutors agree with their medical decision to provide an abortion. Abortion restrictions are direct attacks on the sanctity of the patient-physician relationship and the inherent personal decision made by a patient to access this essential health care. We know that restricting access to abortion impacts the health and well-being of pregnant people, and that barriers to abortion exacerbate existing societal disparities, most profoundly affecting communities that already face health care and social inequalities or inequities. As a national safe harbor for abortion care, New York State must continue to take a strong stance to ensure comprehensive reproductive health care is accessible in our state. We appreciate the efforts of the governor in prioritizing funding for providers. This funding is critical to ensuring that the OBGYN workforce can continue to provide abortion care for all who seek it in our state. I myself is a provider of comprehensive obstetric and gynecological care. I also train the next generation of OBGYNs. This funding is super critical for all of us who provide this care. At a time when other states are forcing patients to seek care in other states, New York is standing ready to provide needed abortion care. ACOG District 2 looks forward to the opportunity to continue to work with lawmakers on ways to support the OBGYN workforce during this unprecedented time in our history. Thanks again to the governor for her support.